Hello again, everyone. Let's dive into another clinical case from a rural area. This case is about a 4-year-old girl brought by her mother due to ear discharge. For the past 3 days, the girl has been experiencing discharge for her right ear. Has a history. She has had multiple episodes of colds over the last 3 months. During the more recent episode, which occurred a week ago, she was prescribed amoxicillin. A dry cough persists. On physical examination, the girl appears calm, with mild tenderness, open palpation of the ear, and light hearing loss in the right ear. Otoscopy reveals a slightly erythematous tympanic membrane with bulging and a small perforation in the pars tensa, accompanied by a moderate amount of otorrhea in the auditory canal. The mother reports a fever spike, though not quantified, about 4 hours ago. Paracetamol was administered 3 hours ago with apparent improvement. Vital signs are within normal limits with a temperature of 36.5 degrees Celsius. We must always remember to adjust the auditory canal. In the case of my patient and in adults, the canal is adjusted by pulling the auricular pinna upward and backward to get a better view of the tympanic membrane during otoscopy. The definitive diagnosis is acute otitis media with tympanic perforation. What should I do as a rural doctor? Four important points: antibiotic management, symptom control, follow up and monitoring, patient education. Do I always need to prescribe antibiotics? The answer is no. Observation alone for 72 hours can be an option in the following cases. The following groups qualify for observation only: is greater than equal 2 years of age, temperature less 39 degrees Celsius, mild to moderate pain and improves with analgesics, ibuprofen or acetaminophen, unilateral infection, absence of significant bulging of the tympanic membrane, or symptoms present for less than 72 hours at the time for evaluation. Antibiotic management is empirical. Streptococcus pneumoniae is the most common cause, accounting for 50% of cases. We prescribe oral antibiotics, either amoxicillin or amoxicillin with clavulanic acid. Either treatment should be administered for a duration of 10 days. I should also consider the possibility of otitis externa, commonly known as swimmer's ear. It's often present with symptoms similar to otitis media. However, in this case, the tympanic membrane should remain intact. As analgesics, I can prescribe acetaminophen or NSAIDs while being mindful of gastric and renal function. Local management is based on keeping the ear dry, using earplugs while showering, avoid swimming and not using ear drops, avoiding the use of cotton swabs or other objects to clean the ear canal. If the tympanic membrane is perforated, otic antibiotics should not be used. What else should I do? Follow up re-evaluating 42 to 72 hours. Patient education, warn about alarm signs, persistent fever, swelling behind the ear, worsening pain, balance problems. When to refer the patient? If there is no improvement after 72 hours, if the perforation is large, if the perforation is located in the pars flaccida or involves the ossicular chain, if the patient has multiple episodes of acute otitis media 3 in 6 months, 4 in 12 months, if the tympanic membrane does not close after 3 months, if complications arise such as mastoiditis, meningitis, or cholesteatoma. I treated this patient with amoxicillin plus clavulanic acid since she had already been treated with amoxicillin. Using the formula for pediatric dosing, the calculation resulted in 13 milliliters every 12 hours for 10 days. For acetaminophen, I prescribed 5 milliliters every 6 hours for 5 days. That's what I gave my patient. If you encounter cases of acute otitis media with tympanic membrane perforation, don't forget the following: provide appropriate antibiotic management, aminopenicillins, keep the ear dry, avoid using otic drops, follow up in 72 hours, refer if there is no improvement or if the condition worsens. During my consultations, I have treated 4 cases of this type. 3 were traumatic, and 1 perforation was in this case of the girl who had been sick. Thank you for your attention.